And welcome to another edition of South Texas Now. This is attorney Joe Flores, and we are doing something a little bit different today. We are doing Zoom, and who better than with a great friend of mine, but also a great colleague, Brian Weinstein. How are you, Brian?
I'm doing great, Joe. Thanks for having me.
Brian, why don't you tell the people about your education, training, background, and why you're here?
I'm a nurse practitioner. I went to school and graduated with a bachelor's in Spanish. So I learned how to speak Spanish. And then I went into nursing school, became an RN, and then nurse practitioner school. From there, I've ended up at the beginning of COVID, started doing some consults with patients who were sick with COVID. And little by little, we've grown Synergy. And it's a direct primary care program. So we don't take any insurance, but a lot of people just prefer to be able to do fast, immediate care. And so we have a program where you could sign up online, or you could sign up with one of our reps on the phone and you book an appointment. And we have all different services. We do COVID consults. We have a care pass program, and then we do some little bit of primary care. So people just don't want to wait in the doctor's office anymore, Joe.
Well, images are appearing in front of your screen from the website and how to get involved in the program. I think it's very exciting. I think that telemedicine has been around for a while through remote patient monitoring of blood sugar, weight, oxygen levels, but never to this point where, because of the pandemic, we've had doctors reaching out across the world, sharing their medical opinions. But here in the US, a person at home in Chicago or in Skokie or wherever they are can reach out to you guys and possibly within hours or shortly within a day or two have all the medicines that they need. And I can tell you from experience, going to certain stores that start with W or C or something, they will say they're out of the medicine, or they'll refuse to fill it,
Yeah.
or there's a delay of 2 to 3 days. No matter what, they criticize the pharmacies that you're allied with that are providing and meeting the customer's need, but they themselves are playing supply chain problems. I had an eye
Yeah.
infection, Tobradex. They said they were out. I mean, I had to literally prove to them that an order had been sent. And if I wasn't a nurse practitioner, I would have just turned my head, gone home, and said, "I guess I don't get my medicine."
It's a shame what's going on. And, that's the problem with insurance. It's good, it's bad, right? So the good part is it covers a lot of stuff. Primary care, the benefit is you pay you pay yourself flat rate pricing, but you don't have to waste all your time. In the modern age, time is money. So you actually save time and save money by using our program. Um, it's a shame that a lot of pharmacies don't even have nebulizers in stock. It used to be they would give them out, like always keep them in stock. But in my opinion, they shouldn't be allowed to be a pharmacy. That's just my personal opinion, without having nebulizers in stock. It's like giving insulin with no syringes. So I just think it's important that everyone have a nebulizer in their home. I had a client who bought 10 of them for Christmas presents. He was giving them away to every one of his family members as a Christmas present last year. He was trying to be a little wise guy, but they all liked it. And so it's just, it's about having access to things on time. You know what I mean? And,
Exactly.
I think
Well, the thing is, people don't have time to wait. And the other thing is that COVID has become so Extintor de incendios, just for let you know, on fire extinguisher.
Oh, okay.
Yes, extintor de incendios. I knew that it was de incendios, apagar incendios, something, but yeah, you had caught me, man, when we did our Spanish the other day, you know, but your Spanish is great. And I think
Uh,
that cultural sensitivity shines through as one of the fastest growing minority populations in America. We want
yeah.
to thank you for also catering to the Latin American population here in the United States.
Oh, yes.
But you didn't start there, you know, for America. People from the great Northwest, people from
Yeah,
Idaho, from
we've had
Utah,
people from all over the
all
place
over.
wanting help, and it's been a phenomenal program through the CARES Act, through what President Trump signed. Yeah, I mean, it's a phenomenal program, and it's just faster to do things on your own instead of going through insurance all the time. I'm not against insurance, but for sometimes in life, it's better not to use it.
Some of the great leaders like Javier Becerra, who was a congressman in Los Angeles, became the attorney general in California, and now is under the Biden administration doing healthcare. With your permission, I'd like to show him this video and let him know how your model works. If you had 30 seconds with him and he said, all right, tell me, why should the government back this sort of delivery? Why can't we keep it like the old days? You go to the doctor, you go to the pharmacy, you go to the x-ray, you go to the lab, and by the time you know it, your daughter's run ragged and half a tank of gas gone. What's wrong with that system?
Well, that's like that's like telling people that watch Netflix to use VHS. You know what I mean? Remember Blockbuster Video?
It was one of my favorites.
It was my favorite place when I was a kid, and no one thought they would ever close ever, and now they're toast. My point is old school medicine, which is good. I'm not against it, but for certain things, it's not worth, it takes more time. They call it a waiting room. Why do they call it a waiting room? You just sit there and wait. I mean, I had an experience when I went to a doctor, I got stuck behind a train, right? One of those long freight trains. By the time I got there, they told me to go home. So that's one of the problems with healthcare is if you're not, it's all based on the doctor's appointments, and we all used to waiting in a waiting room. How often have you waited in a waiting room and the doctor is on time? Like how often in your life have you seen a doctor and you didn't have to wait? If you come in at 3:00, have you ever seen the doctor on time, Joe?
Crickets.
Crickets. Okay. So that's why, you make an appointment, but you're there all day. You know what I mean? And that's the problem with health. That's part of the issue I feel is certain things could be done at home. I had a patient who died because a medical provider ended up giving the patient COVID. So it's like, I'm not against clinics, primary care. I'm just saying for certain types of people, it makes more sense to do things via telemedicine. It saves time and it's more efficient. No risk of spreading, conditions, COVID, whatever the flu is. Telehealth actually saves money and time, and it's all about prevention. If we could give people nebulizers and remote monitoring equipment, which is very cost effective, we could keep people out of the hospital.
I'm wondering, I hate to interrupt, but I was just thinking about something. Have the home healths kind of wised up and said, hey, we can reach out to Synergy, and you know how hard it is to get a hold of a doctor. And I'm not being critical of doctors, they're busy. And that's why they get with nurse practitioners, but have the home health said, hey, this is a great model.
Not yet, Joe. No, because they're all with the recent changes in home health, they're very they used to have the 60-day episode and now it's a 30-day. They're very home health industry has changed, and it just has, which I think it's good. You know what I mean? But they have not embraced what we do because we don't take Medicare or Medicaid or insurance. We're private, but it's about being more efficient with time because people don't have the time to wait in the waiting room all day. So I'm not again. I do think there's a value going to see doctors and clinics. It's just certain things you can't do, but a lot of things can be done with telehealth. So I foresee in the next many years, a lot of primary care being shifted to, telehealth, because it actually saves, in terms of Medicare, I think it could save the system a lot of money, by embracing full on telemedicine, by having, when people are about to go to the hospital, if we could enhance our Care Pass program, which we developed, and we could try to keep people at home, hospital at home, before they go to the hospital. And, by deploying resources, oxygen, nebulizers, remote monitoring equipment, I think we could really save lots of money by treating people at home via telehealth technology, and trying to only send people to the ER when the prescriber feels they have to
Right.
go. You know what I mean? So that, not saying that's going to happen, but in my dream world, you know what I mean? That would be, a good way to help, because people don't want to go to the hospital all the time, wait in the waiting room there. So of course, if you need an X-ray, there is mobile X-ray,
And
you know what I
there's
mean, available in
EKG
lots of
lab
cities.
every.
Yeah,
your
it
house.
depends on the city. In Chicago, there's mobile X-ray. I'm not saying it's available nationwide, but a lot of things can be done in the big cities at home. X-rays, EKGs, echoes, right? IV antibiotics. Home health is limited to post-hospitalization. So you can only, they don't send nurses to the home unless pretty much, because of the way it is with the 30-day episodes now, right? But if we embrace telehealth technology and home health nursing and really went full blown with it, I think it would be phenomenal. That's just me. You know what I mean?
No, well, I'm thinking about that, and and if we can't get it there right away, I think that our leaders need to think about these types of companies and not make it so onerous, not make it chilling effect where people are afraid. I'm telling you, people are afraid to open up a home health, are afraid to open up a company, because right away the government wants to jump on them and say, you owe X amount of money back. Even though the billing was a mistake, no, it wasn't a mistake. You did it on purpose. Those kinds of things are obstructing it. The other thing is mass incarceration. You and I have had this conversation about individuals that are sheriffs in Texas and other places where they don't want these nonviolent prisoners in their jail. They want them receiving treatment. And if they have to be in their jail, what better way than using a model like Synergy that
Yeah,
has a video monitor?
I can tell you a story. We had an inmate and who was in the ER multiple times with COVID. The government had to pay cash for, pay the hospital for all those times. It cost lots of money. They sent sheriffs, right? Guards. And then one visit with me, the guy's better in 2 days. So that's about, saving money, and most importantly, time.